Time now for Restoring the Soul of Healthcare from the HELPcare Clinic in Austin.
And it is that time, so we jump in and we visit with our friends from the HELPcare Clinic, Dr. David Strobel and Lee Acey joining us this morning. Gentlemen, good morning.
Good morning. Glad to be with you.
Always good to have you with here today, and I love our topic for today because as we've talked about the HELPcare Clinic, I know I've heard people ask a lot of questions about the whys, the wherefores, and how is this different and how would it work for me? And today we're going to talk about how you can actually kind of get the experience of the HELPcare Clinic and make that decision to become a member.
Yeah, we've had a lot of people, over the last year, where they'll call and say, "I'd like to be seen here," and we're a membership-based clinic, and so for some people that's kind of a barrier, and because they're not familiar with what the idea of membership is for primary care. And so as we've sort of evolved and we've thought about ways, we want to find ways to say yes to people and help them get the care that they need when they need it. And even if they haven't really gotten to the point yet where they're ready to say, yeah, I'm ready to join. And so we announced a couple weeks ago that we were having, cash pay prices or fee for services prices for office visits. And now we've actually, what we're talking about now is how we can provide a continuum, a way for people to start with maybe just getting that particular need met, and then that way they can experience what it's really like, and then they can see if it's something that's for them, and then after that they can possibly join if they're interested.
Kind of your version of before you jump into the deep end of the pool, dipping your toes in to check the temperature.
Yeah, exactly. And so we looked around, and as we looked at 6 area hospital systems, including Mayo, Allina, Homestead, Mercy One, and a couple others. And we looked at what their prices were for their office visits and at various levels of time and intensity involved with the provider involvement. And we ranged those from low to high. And then we said, for people who want to try HELPcare Clinic, it's 25% off the lowest price of anywhere else. And so it's like, you can't lose because you're going to, for that office visit, it's going to be less expensive than if you went anywhere else in the region. And then the second part is that on the lab tests, and that's what the last part of it that we just put together, we've developed pricing for lab tests that are at least 50% lower than elsewhere. And so if someone wants to come in for a first appointment, they can have their appointment, which they'll pay for what their labs are, and then they have an opportunity to say, "Yeah, I think I'd like to join." And if they do, then the amount that they've paid then gets applied toward their membership. And so we also then just have because we don't want to undermine the membership concept, we have a conversion fee. For people, it's $25 a month. Once they're seen here, if they decide right then that they want to join, like, wow, I'm home, this is where I want to be, there's no conversion fee. They just pay the initiation fee. But otherwise, if it takes them a while, then there's more paperwork and stuff for us. So that's why we made it $25 a month after that. So if they join in the second month or the third month, it's an extra $50.
Sure.
But it's a way that they can, at a really low risk, be able to actually no risk because they're paying less than they would elsewhere, other places, to be able to get the care that they need.
Well, again, obviously you can do that because you really believe that once people experience the HELPcare Clinic difference, they're more than likely going to convert that visit or two into a membership.
That's right. Exactly right. Yeah. I mean, and we've seen that happen a lot already just with, previously we were saying, well, we could offer you a 1-month trial membership. And it's like, well, that still doesn't really fit with because at that point then we weren't necessarily doing all the labs because those have some expense with it. And so it wasn't really the full experience where now they can come in and they can experience the whole thing. And then then we can say, by the way, if you had a membership, this will all be included. And it's only this much more to have the membership for the whole year. And this also opens up some other neat opportunities for people with a health savings account, because the way the IRS has ruled, health savings accounts can't be used for membership kind of things. You have to have a specific charge. I saw Dr. Strobel on this day, and it's this amount of money, and so a membership like ours doesn't really fit with that. But in this way, for people who have a health savings account, if they want to just do the cash pay right up front, they can access those health savings account dollars. And then when it gets up to being pretty close to what the cost of a membership could be, they can pay the conversion fee, and then they're covered for the rest of the year.
That sounds fantastic. I know through your website, too, if someone's looking at the blog here today, you actually can get a copy. You have a booklet to really learn more about the HELPcare Clinic membership and spells out all the benefits.
Yeah, we have a booklet called Saving Through Membership, and so if they go to our website at helpcare.health, it's the first blog post that's up there. Talks about this whole program, but also has a link to the Saving Through Membership booklet, because it's and that's about a 18-page PDF that they can download, or if they'd like to stop by, we give them a hard copy of it. That kind of walks through why, what's broken with the healthcare system, especially related to insurance, and then why this is a much more cost-effective option.
So if you have $7,000 in your health savings account and you have a $3,000 deductible, then you should have the $3,000 there in case you need expensive care. But in the meantime, now you've got this extra money that you'd like to be able to use to decrease your out-of-pocket costs for the membership, but you can't use it. Well, this is a way of doing that. And we've got a little bit different structure for folks that have already joined as far as how much the conversion fee would be. So there's kind of a cap on that, or probably will be. So those folks that are already members might actually say, well, I would like to do this for the next year. And maybe even several years in a row. And so that gives them the opportunity also, even though they're already committed to the membership type model.
Yeah, very interesting. And really, the big picture here is you try to make this as absolutely easy as possible to just explain it to people, because this is something, it's not necessarily radically new. It's just a way of doing things that we just haven't done for decades. And to get people to understand it, that's probably the biggest obstacle to get people to become members.
Yeah, I mean, people are used to paying, per visit, when they go, when they get medical care. And that's and so by the real essence of what we're doing is taking the insurance companies out of the mix and having them not be, taking a cut off of this. And so because of that, because we're going direct to the consumers, we can have those costs be lower, and they are at least 25 to 50% lower than what they would pay in the insurance-based healthcare system. And so that this way, I mean, the one thing is that we don't take insurance, this isn't counting against their deductible to do that. But then again, if they've got a health savings account, this actually might be a really great option for some people. Right. But mainly, we want people to be able to try before they commit. And we appreciate when they stop by and we can give them a tour and we can talk about it, but there's nothing quite like being able to spend an hour with Dr. Dave or Stephanie or Elizabeth and really get to have that heart-to-heart talk about your health. And the fact that people can do it now with less of a upfront commitment, as you said, we believe that once they do that, they're going to say, I'm home. This is where I want to be.
Absolutely.
There are other membership places, that have this kind of option. I mean, you can go to the YMCA and you can pay to go today to find out what is it like. But if that was their main business model, you can bet that they'd be out of business because you'd have to pay every time you go in. So, the business model is, well, I've already paid the membership, I should make use of it. But for people that are wondering about, is this the place to get a membership? This is how it works. So we want to develop a system that supports the idea of membership, because that's really where the savings is. But we also realize that not everybody is in that position to take that step right away. This is a really good idea that Lee has come up with as to how to make this work and to help people feel more comfortable.
Absolutely. Let's finish up with this real quickly. Remind people where they can find this information, how they can sample it, and how they can stop by and see you or check you out on the web.
Sure. Well, they can go to helpcare.health. That's HELPCARE.health. And they'll be able to see the blog post that explains this, but just even click on the Learn More button to learn more about our membership. They can stop by and see us in person at 308 4th Avenue Northwest, which is just a block east of St. Augustine's, or they can give us a call at 507-279-2345, and we'd be happy to talk with them about it.
All right. Well, fantastic information, and again, a great way to be able to sample, if you will, and dip your toes into the pool and find out if this is the right plan for you. Check it out at the HELPcare Clinic. Gentlemen, have a fantastic week, and we'll talk to you next Thursday.
Very
Sounds
good.
Great. Thanks, John.
Blessings, John.
All right. Thank you very much.